Good afternoon, Granville County Public Schools, and welcome to our second family gathering. Those of you who know me know just how important the word family is to me. So we are taking time this afternoon to provide recent, updated information with you, our work family, pertaining to the re-entry of school to the vast majority of our pupils upcoming Monday as they return to school to a portion of our Plan B. Heard this morning someone called today Thankful Thursday, and I thought it was an appropriate way to capture this afternoon's meeting because I assure you later, Granville County community of children, parents, grandparents, neighbors, friends, and especially our Board of Education executive team and I, and many more unnamed, are truly, truly thankful for each and every one of you. We value and appreciate the many roles you play to serve our community's greatest gifts, our children. So if you hear nothing else today, please hear this. We are thankful and appreciative for each and every single one of you. Now, due to the sheer volume of individuals we have participating in the meeting this afternoon, we were not able to have two-way communication. So we have prepared an email link that has been sent to you because we want to hear from you. Yes, we are listening and we are concerned about the way you feel. So please check your email for the link. Your questions, your comments, your concerns, and yes, even your kudos are important to us. Feel free to reach out to us and let us hear from you. Now, before I launch into today's presentations, I have some information I'd like to share. Please do not check in on your students and your colleagues for that matter. I'd like for us to pay particular attention to their mental health. Yes, that SEL portion of what all of us do, whether virtual or in person. It's important we make certain everyone looks safe and cared for and that their mental health is provided for. Second, don't forget, we're looking forward to everyone reading 20 minutes a day. The literacy and the reading is a priority in Granville County Public Schools. It's important in our district, and I need everyone working to make certain we achieve this goal. So please encourage reading, reading, reading. Now, the book bus this fall is a little different from the book bus this summer. I hope you've heard about it, but we're running two buses, one in the northern part of our district and one in the southern part. And it has books for students pre-K through 12th grade. Encourage our students to pick up books because we want reading to be a part of all of our students' lives. Now, on to the slides and the presentation for today. You may have heard some of this information, but you may have not. So we want to share information we hope you find helpful as we make this transition. Our top priority is to keep our students and staff safe as we go through this novel pandemic, the COVID-19 crisis that has hit our nation since March. We've continued our work with the CDC, our local health department, the North Carolina Department of Public Instruction, and the governor's office. We will continue following all of those guidelines very closely. On September 17th, something new happened in our state, and Governor Roy Cooper put this statement out. Beginning on October 5th, North Carolina public school districts can choose to implement Plan A for elementary schools. So our Board of Education grappled with this in our board meeting last Monday, and you will hear in just a few moments how this will impact our district. Next slide, please. We've been following these protocols by involving several individuals throughout our district. And at this time, I would like to thank our district nurses. I'd like to thank our local health department. I'd also like to thank our district task force. We have a reentry task force with individuals who represented several of our schools. They did an incredible job of lifting several important, difficult questions. They posed lots of what if statements, and we needed that as we returned to schools. We had a parent advisory council who worked with us, our teacher advisory council, our principal advisory council, and everyone did an incredible job helping us develop and think about dates that were presented to our Board of Education. The one thing I would like to make certain everyone understands is there is no magic bullet to this work, and there is no one metric we will adhere to with the readiness indicators in making decisions going forward. So I'd like to again thank everyone for the work they've done, and understand we will continue working with and adhering to readiness indicators as decisions are made. This is the plan our Board of Education selected this past Monday night. We wanted to share this with everyone in Granville County Public Schools today. Our pre-K, kindergartners, and our EC self-contained students returned to our buildings on September 28th. They, at this time, are in our buildings for just one day a week for face-to-face instruction. On October 19th, they will return to the calendar full Plan B for 2 days of face-to-face instruction on October 19th, and our board determined that the date of January 6th will be when our district's students, pre-K, kindergarten, EC self-contained, and our grades 1 through 5 will return to Plan A. That is when they will begin their Plan A. I need to say begin Plan A. Our grades 1 through 5, elementary students grades 1 through 5, will return this upcoming Monday for 1 day. Remember, we're doing this very gradually in Granville County Public Schools. One thing we heard, to do this well. Let's take our time and to do this well. Let's do this gradually and in a staggered manner. So those youngsters will come this upcoming Monday for 1 day, and then on October 26th, they will do this for 2 days, which is the full Plan B. On January 6th, they will begin the A schedule. The A schedule. Again, that is just for elementary students. So our grades 6 through 12 students begin 1 day of instruction this upcoming Monday, October 12th. They will begin 2 days of face-to-face instruction on October 26th, and they will remain on that schedule at this point for the remainder of the year. The governor did not allow anyone besides elementary students to come for a relaxed type of environment except for elementary students based on research, health research in partnership with the CDC and DHHS at this time. What I would like to do is, it is important for me to share a little bit about the decision for 4 days of instruction, because we had several recommendations come to the table. So if you would allow, just give me a moment to talk about why we really advocated 4 days. It is not that 5 days did not come our way, because it did. People wanted to know, why not 5 days? Why shouldn't children come 5 days? And I want to tell you, I'm an advocate for our teachers who are pulling, in my opinion, double duty right now. Many of you are teaching face-to-face. You will be on starting Monday. Many of you will do that. You're already serving students virtually and remotely. We're calling Wednesday P Day. You're already using it for planning, preparation, PLTs, professional development, personalized skills, IEP meetings. Shall I go on? You need 8, 9, and 10 days that you don't have. And we recognize that in Granville County Public Schools. So if you just give yourselves a pat on the back, I wish I was there to do it myself. So of applause for what it is you've already done and what it is I know you're going to do. But our board recognized this on Monday night, and when we do move to that A schedule, it will be for just 4 days. Now, that does not mean Wednesday is a day off. It is the day for you to continue to do these things, but it does allow you to do it with that Wednesday intact to do the other things we know you need that day to do. In addition to going home, taking care of your own family. So we recognize that in Granville County, and allow me to say thank you. Thank you so much for continuing to wave the banner in the manner in which you've done it. We are most appreciative for the type of educators we have in Granville County Public Schools. Thank you. Next slide, please. Let us talk a little about this slide. Dr. Winborn, I may get you to join me in this. Now, typically, when a decision is made in a school district for one school, it is normally made for all schools. In this pandemic, it's a little different. So we are experiencing a lot of firsts. And I just wanted to take a little time this afternoon to talk about how this might be different. I need everyone to stay on alert. I need you to remain on alert because we could possibly revert to Plan C at any given time. We could go remote at any given time. And I need everyone to understand that. And you say, why is that, Dr. McLean? Well, it depends on what is occurring in your school environment at that time. We may have to do something different in one school that doesn't necessarily impact other schools. I hope that makes sense to everyone. We are not going to give names of students. We are not going to give names of children. We are going to work closely with the health department to be as safe as possible, but we may have to do some things differently from school to school. So I just need everyone to remain flexible. I need you ready to pivot at any time, and I need you to trust that we're doing what we need to keep everyone safe. So if you receive an announcement that says this particular school needs to stay home and remain remote for the next day or two while we disinfect the building and do certain things, please just trust that it's in the best interest of that building. We're just trying to take good care of everyone. Dr. Winborn, will you just chime in there for a moment in case I missed something, please?
Thank you, Dr. McLean, and good afternoon, everyone. I think that was very well stated. I think you covered all the bases. I might just add that this past weekend, we did send some communication to our families about this question: what happens if there's a possible COVID case at my child's school? And as Dr. McLean said, we will need to, as a school district, adhere closely to the privacy guidelines that are set forth in FERPA and HIPAA, and in some cases other statutes, about the identity of those who may be displaying symptoms or be testing positive. So we will not be identifying information about individuals with whom COVID may be impacting. But we will be communicating in general terms and as transparently as we can about what is happening within a given school building. And in every case, we'll be consulting in real time with our local health department, and they will be advising us about the best course of action to take in the event there is a case, multiple cases, or what is considered a cluster. And as Dr. McLean said, we will deal with those on a case-by-case and school-by-school basis. So what impacts one school may not impact another. So I think you stated that very well, Dr. McLean. It will be very different, and flexibility and agility and that ability to pivot, as you said, will be very important for everyone, because we could revert back to remote only within very little short notice. It's a possibility.
Thank you for that, Dr. Winborn. Just know this will not be like snow days when I make a general announcement about the entire district. If it is related to COVID-19, it will be very school specific. So I just ask for your patience and I ask for your flexibility. Next slide, please. It's now time to review our new standard operating procedures. Dr. Winborn, I turn this portion of the presentation over to you.
Thank you, Dr. McLean. So hopefully what I'm about to review is old information and is going to be very boring for you to listen to. This is a repeat. However, it is still so vitally important to keeping our schools safe for our students and all of our staff. The first thing I want to talk about is screening. Screening is required for all students, all staff, every time you enter school property. We realize that sometimes this seems a little inconvenient. However, maintaining the integrity of our school environment is critical. This is one of the best tools we have to prevent those who may have symptoms from entering our school buildings. We'll also be limiting visitor access to emergency situations only. Emergency situations only. Hopefully by now you have all watched our Return to Learn video, and I'd like to thank the students of those employees, or the children of those employees at Stovall Shaw Elementary School and West Oxford Elementary School, who helped put that video together. They were the actresses and actors in that video that helped sort of showcase what it's going to look like when our students return back to school. So this screening is going to occur every time anyone enters any of our buildings. Next, of course, face masks. They are required by all students, all staff, on all school property at all times, with a few exceptions. First, when you're eating or drinking, or you're having strenuous physical exertion, you, of course, may remove your mask. We're also working with our principals to establish mask breaks during the day for students. Hopefully those will be occurring outside or in larger areas where students can socially distance to be safe. Also, there will be allowances made for individuals with physical or developmental disorders or some type of medical condition. There is a medical face mask waiver that parents can complete. Those are at each of our schools. That does require the documentation from a healthcare provider. And we do also have a waiver for staff members as well, and those are handled through the HR department. A quick note about face masks. The state of North Carolina has provided 5 cloth face masks for every staff member and every student. Okay, so there are 5 that are provided up front. In addition, we have thousands of the disposable face masks available for those students or staff members who may come to work and have forgotten their mask. We will have supplies of those on our school buses as well. Our nurses are also working with us to help communicate what types of face masks are approved. At this time, it needs to be a mask that completely covers the nose and mouth, fits snugly on your face, and does not have any vents or openings in the mask itself. Next, social distancing. Under Plan B, social distancing is required. It's not optional. This is mandatory for all students, all staff, on all school property at all times. And this is very difficult to maintain. It's a natural human tendency to want to sort of get a little bit closer than 6 feet when you're communicating or working together on projects. But we have to be vigilant about this. This, again, is one of the best tools we have to keep everyone healthy and safe. There are a few exceptions. Members of the same household, brothers and sisters or siblings or folks that live together, when they're on the school bus can sit with one another. Also, when staff members are screening or attending to students that have been trained, the staff members that have been trained may get within the 6 feet as well. But again, very, very important. Dr. McLean referenced this term readiness indicators on several occasions. These are really the set of criteria that we're using to help guide our work when it comes to re-entry. And we had a team of people that helped develop these readiness indicators. And they exist in sort of 4 different categories or buckets. The first category has to do with our operational readiness as a school district. How ready are we? How prepared are we to take on these new ways of doing school? This would include the amount of PPE, sanitizing products, other supplies that are needed. Do we have those in sufficient stock over the next 60 days, 90 days to do what we need to do? The good news is we are well equipped for that. We now have plenty of face masks, gowns, gloves, face shields, plenty of sanitizer. We have fogging machines. We have everything that we need to see us through the next at least 90 days. We also have been looking carefully at the number of substitute teachers that we have, because we know that some staff members may be out for a variety of reasons. And we're happy to report that number is steadily increasing. This summer it was down to somewhere around 30, and we're now up over 70. So if you know of anyone, a friend, a neighbor, a family member who's interested in becoming a substitute, please help recruit them. Just direct them to the Office of Human Resources, and we will get them trained. We will get their background check done and get them in a classroom, making a nice little paycheck as soon as we possibly can. So please help us recruit substitute teachers to work in our schools. The second bucket of readiness indicators comes from the COVID data from our health department, both at the state and local levels. And Dr. McLean gets briefed on, almost a daily basis. When you say, Dr. McLean, I know that she and the health director, Ms. Harrison, talk frequently. Do you want to mention something about that real quick, Dr. McLean? Dr. McLean, you may be muted.
Absolutely.
There you
The
are.
health department has been incredible in keeping our district updated. There we go. Can you hear me now?
Yes, ma'am.
Let's see. Dr. Winborn, can you hear me?
Yes, I can hear you.
The health department has been an incredible partner throughout this entire process. They have kept us in the loop, updated. They work with myself. They work with our nurses in our region and across the state. And we have an agreement that we have built this sense of trust, and we want to trust everything they have to say to us. We can pick up the phone and call them. They call us, and just know that whatever their guidance is, we are going to make certain our community family, our Granville County Public Schools family, will know. We have a sense of transparency with them. They've reported at our last 2 board meetings, and we will continue being kept in the loop by our health department.
Yeah, it's a great partnership. And really, anytime we have someone with a failed screening, or that an employee or staff member that reports symptoms, or eventually students who may report symptoms, our nurses immediately reach out and work hand in glove with the folks in the health department, and they do the contact tracing, and they are the ones that make the decisions about next steps. Those decisions are not made by Granville County administrators. Those are made by healthcare professionals. It's very important to understand that we rely on the experts to help guide us through these decisions. So the third bucket is our stakeholder survey data. And as you probably know, there've been a lot of surveys that have gone out, um, over the summer and early this fall. As Dr. McLean mentioned, there is a feedback form for you to fill out today if there's stuff you want to share with our team. Of course, we were super proud to get all those student responses. We had over 2,500 student responses, and it was just wonderful information that Dr. McLean was able to share with our board and really helped guide our decision making. Great to hear from those kids. And then finally, we are paying attention to the emerging research. There is constantly new information coming out. And Dr. McLean has made a connection with Duke University, in particular, that is really proving to be very valuable. They are working on some clinical research studies, and so she's been in touch with them on a frequent basis, sharing information and exchanging ideas. So all four of these things inform what happens with our reentry moving forward, and in some cases, if, like we said before, when we have to be on alert for moving into remote status temporarily. All right, with that, I will turn it over to Dr. Michael Myrick.
Good afternoon, everyone. Dr. Winborn, you're going to have to share because I can't share my screen. Thank you. Good afternoon again, everyone. I know lots of parents and students, as well as our arts teachers, are really excited to get back started, but I just want to remind everyone that at this time, we will continue to follow the advice of the Granville Vance Health Department and the guidance found in our Lighting Our Way Forward document. But we will continue to explore options in this area to support our students, and we just want to let you know that. Looking forward, next slide, please. Athletics has been in the news quite a bit. If you follow the NFL, the NBA, MLB, college sports, you know, that is the hot topic that everyone is talking about. Well, our board on Monday night approved a plan for our athletics to start back on Monday with skill development, with our first game and practices starting in November. We're going to start first small with cross country and volleyball. These are the sports that have been approved by the North Carolina High School Athletic Association. But I just want to caution everyone that even though we are starting our skill development, schools in our conference, their districts have not made a decision on whether or not their schools will play sports this year. So we're just still waiting on that piece to come down from everyone. But we do want to just let everyone know how excited we are to start our skill development in October for cross country and volleyball, basketball, soccer and lacrosse, and football. So we're looking forward to another great athletic season once it's safe to get back on the field. Next slide, please. We listened and we heard you loud and clear about needing some support for your school-aged children during this time of remote learning. So we've developed the remote learning support centers. We put this information out to everyone in our Friday memo last week. And we also sent a call out earlier this week for the opportunity for you to take advantage of these limited spaces. The registration for this will close on this Sunday night, and we will start notifying people next week who are eligible to attend. We will open on October the 19th. We will run 5 days a week through December the 18th, and our centers will be open from 7 a.m. until 6 p.m. We are so excited to partner with the Henderson Vance YMCA. They will be providing some fun enrichment activities for the students once the school day is over and they have finished all of their learning for the day, worked on their homework and all of those things. So we're very excited about this opportunity. Next slide, please. Finally, new Safe Enrollment for second semester. As you know, we talked a lot about the Safe Enrollment at the beginning of the school year. Well, now we are going to give our parents the opportunity to change their minds. If they want to change the option for their children, we will open the new Safe Enrollment on November the 15th, and we will run it until we will open on November the 4th and run it until November the 15th. Unlike this summer, we are only asking parents to complete the SAFE if they want to change the option that their students currently have. So we are looking forward to those changes, and I know that our teachers are excited about those opportunities to maybe get those students back into the classroom. So we're happy to offer this to our families. Next slide, please. And I think it is Mr. Perry with HR.
Good afternoon, everyone. We in the Human Resources Department would like to provide a few updates. We have received calls and emails in regards to leave type when it comes down to employees who may be experiencing symptoms of COVID-19 or have received a medical diagnosis of COVID-19, been advised to self-quarantine or self-isolate by local officials or by the health department. These individuals may qualify for the Families First Coronavirus Response Act, which we call FRCA leave. Of course, medical documentation is required to receive this leave. This is paid leave up to 80 hours of pay. If you have questions, please contact Beverly Fedewa in the Human Resources Department. Next slide. If you are experiencing symptoms of COVID-19 and have been around someone who has COVID-19 and you have been asked to self-quarantine or isolate, you need to immediately notify your supervisor and tell them what symptoms you are experiencing or what has been shared with you by health officials. Your supervisor, in that turn, will contact school health officials and human resources for next steps. Human resources, or rather, health officials will contact you to begin the contact tracing process. And that's to make sure that those individuals that you have been around may not have been exposed to possible COVID-19. If you are asymptomatic and are able to work from home, your supervisor will discuss options for you about being able to work from home during this time if you are a classroom teacher or in a position where you may require a substitute. We know this option is not available to everyone. Again, if you are sick and cannot work, please stay at home and you may qualify for the FRCA leave, again, which is up to 80 hours of sick leave. Just a reminder that this leave does expire December 31st, 2020. This was passed with the CARES Act back this spring. So if there's extensions, we will let our staff know. Next, two more reminders. Dr. Wimborne, let's see here. Just a reminder about our peers group supplemental benefits. If you go back one slide, please. Here we go. The 2021 open enrollment period is now open for our supplemental benefits, and that would include our dental, vision, flexible spending accounts, all those accounts that we like to set up to supplement our basic health insurance. That period is now open. There's a link, active link here at the title. Please be sure to review the employee benefits manual so you'll know exactly which benefits you would like to enroll in. After November 13th, only life-changing events can initiate changes to the plan, so you must act immediately. If you have questions regarding the supplemental benefits, please be sure to reach out to Kathy Bradley. Next is our state health plan. This year, the state health plan open enrollment begins a week from today, and is a very short window this year. It's only 2 weeks, and that runs from October 15th until October 31st. Everyone that's on the 80-20 plan, if you do not act during this period, you will be automatically reverted to the 70-30 plan. 70-30 plan. And don't forget, you must answer those tobacco attestation questions in order to remain with the financial incentives that come along with the plan. Remember, act immediately when you receive the link to change your open enrollment plan. And finally, just some information about our EAP. This year, we were proud to announce at Convocation that we have partnered with McLaughlin and Young, which is called My Group, for a free confidential employee assistance program. It's free and confidential. We never know who enrolled in the program, who seeks services or resources unless you have been referred by human resources. Otherwise, you can receive assessment and counseling services, online services such as searchable resource databases if you're looking for elder care, pet sitters, saving centers for traveling, car rental insurance, legal services. You get a free 15-minute consultation with an attorney, and other financial services. And this is free, no cost to all of our employees, part-time or full-time. There are two easy ways to access. There's a number here, as well as a website and the directions for logging in. And next up, we have some very important information from Ms. Beth Day.
Good afternoon, everybody. I have some really good news to share with you this afternoon, and so I hope that everybody will listen up to this part of the presentation. We are going to be talking about the $350 bonus information. If you'll go to the next slide. The first information, you might have heard of this. The state approved a bonus, and as part of their salary bill that they passed this year, it included a one-time bonus of $350 for teachers and instructional support employed as of October 1st. And the state defines teachers and instructional support as people who are paid off of the certified teachers scale. And it must be paid by October 31st. So it will be paid. Our payday this month is October 30th. So that will be included in that payday. It's not subject to retirement. As you can see here, this is a cut and paste from the state guidance. And then the last bullet, there will not be performance bonuses. And what that means is in past years, the state had paid in January some bonuses for performance based on like third grade reading, various tests, CTE, advanced placement. Those bonuses will not happen this year in January, but the state has provided $350 to all teachers and instructional support. But you might be sitting there thinking, well, that's great, Ms. Day, but that doesn't cover me. What about me? Well, the next slide, please. The Board of Education thought the same thing, and they wanted to thank all of our employees for all the hard work that is done. And so they provided a one-time $350 bonus to all full-time employees that are not covered under the state bonus. So, and in addition, they're also going to provide a one-time $25 bonus to bus drivers that work one shift per day, $50 for bus drivers that work both shifts per day. And it follows the same guidelines that the state, some of the same guidelines that the state follows as far as being employed as of October 1st, and it'll be paid in our October paycheck, and it's not subject to retirement. So this thank you on this slide is from the Board of Education to all of our employees, but I also would remind you to thank our Board of Education, because this is a Granville County Board of Education decision to pay all of our full-time employees this $350 bonus. So thank you. And with that, I'll turn it back over to Dr. McLean.
Thank you so very much. Can you hear me, Dr. Winborn? Wonderful. I would just like to end by saying this. Thank you to everyone who joined us this afternoon. Ms. Day, you're the star of this show because everyone sort of leaves with something. So we thank you for that wonderful report there at the end. Lots of good information. We'd like to thank everyone for everything they do in Granville County Public Schools, and our Board of Education recognizes it. So if you get an opportunity to send them a nice email or a quick note, just thanking them for what they've done financially to say thank you to you, I think it would be a really nice thing to do. This concludes our updates this afternoon. So on behalf of our Board of Education and our executive team, just everyone in our community, thank you once again. Please know just how valuable all of you are to all of us for everything you do. Now, Mr. David Richardson, our chairman of the Board of Education, our closing remarks the last time for our very first family gathering, and he wanted to do it again. Unfortunately, he had a death in the family yesterday and was unable to be with us today, but he sends his sincere thanks and appreciation for everything you do. I ask you to keep his family in your thoughts and prayers. For those of you going through and battling COVID-19 or having battled this novel pandemic, just know you're in our thoughts and prayers as well. We ask all of you to take good care. Thank you once again for joining us this afternoon. We look forward to seeing you. Stay safe, stay safe. Good afternoon, everyone.